Hi, I'm Dr. Mohan Thomas. I'm going to be speaking to you, for people out there, on something called PCOS or PCOD, polycystic ovarian disease or polycystic ovarian syndrome. Now, there's lots of them floating around. Some know about it and most of them don't know about it. This thing starts raising its ugly head early on. It can raise its ugly head maybe by around 12, 13, 14 years old when females start getting their periods. Now let me explain to you first what are the symptoms you might see. All right, there are three. One is increased hair growth on the face. Two is irregular periods. Three, insulin resistant fat in the midriff, central obesity. Now you may have one of the symptoms, two sign, or a third sign. We may have one, two, or all three of these signs. Now there's no need to panic. This is manageable completely, very common. I see lots of people with this problem, and very often I am the first one to kind of notice this, and then I bring it to the attention of the mother and then direct them what to do. So let's start off with hair reduction. If you have excessive growth, once the growth is completed, the chronological age should be 17 to 18. If for some reason the confidence is shaken, there's peer pressure or something else, this can be done earlier after discussion with the young lady, mom, myself, endocrinologist, or whoever else is involved. School authorities can also be involved in this discussion to make sure that the child does not lose her confidence in school and people are not picking on her. All right, the next thing would be irregular periods. Now, what do I mean by irregular periods? If you are late by a day or two or a week or 10 days, it doesn't matter. But let's say you start missing a month, 2 months, 3 months, 4 months, and now comes back again. Now that could be the sign of PCOD or PCOS. Now the insulin resistant fat or the little tummy, that is the third thing. Now once you notice these things, what is the other thing? How do you go about making sure whether your daughter has it or it doesn't have it? Very simple. Have somebody write you a prescription, doctor, myself, or anybody out there, for an ultrasound of the ovaries. So when you take an x-ray of that area, you should be able to see some cysts around the ovaries. Many times, most of the times, these cysts are there. Sometimes they may not even be there, but you'll have PCOD-like symptoms. Now, once we have a diagnosis of PCOD, then what I do is I generally bring in an endocrinologist on board to make sure that the endocrine system is managed the best we can. It is a combination of a change of lifestyle to make sure if the patient has excess weight, we're able to reduce the weight. If there's insulin resistance, we reduce it with medication or change of lifestyle. Sometimes you can be in a hyperandrogenic state. Simple English, female hormone, male hormones. Male hormones are higher because female hormones are lower because of lack of periods. So then what will happen is you will have hair fall, male pattern baldness, all possibilities. You can have an outbreak all of a sudden of acne. Acnes come in different flavors and different sizes. It can be on the face, it can be on your back. So those need to be looked at and managed as a separate entity. So now we have managed certain things. Now we look at the way the body shape of the child. One can be obese or overweight. While that's generally the case, it's not always a norm. You can have young ladies with PCOD that are very skinny. That's possible too. So just the body form alone is not an indication of PCOD. Other things that may come with obesity is you will find a dark streaks here in the neck, dark underarms. This is known as acanthosis nigrans. It's a condition by itself that can be managed separately. Don't want to discuss this and confuse the whole business. So, in short, recognize easy, early, treat them early. This is very manageable and very common. You shouldn't have red flags going in and alarms going off. This is, like I said, quite rampant today, and we can manage it very easily. Thanks for watching, and I hope this was useful to you and you had as much fun watching it and learning as much as I had sharing this knowledge with you. Take care of yourself and stay well. Take care.